So in this video, we're going to be talking about the different types of asthma. Now, just in a nutshell, what is asthma? It's an inflammatory condition that causes the airways in the lungs to get narrow and to swell, and in many cases, it can even be a considerable amount of mucus that can be produced. Now, this can cause trouble with breathing, resulting in coughing, wheezing, and even shortness of breath. It can be anything from mild to quite life-threatening with severe asthmatic attacks. So in this video, let's talk about the types. Now, I have a separate video discussing everything about asthma and what can be done about it. Now, in this condition, I'm sorry, in this video, we're specifically going to be talking about the different types. So first on this list is exercise-induced asthma. Now, this is basically a type of asthma that it's also known as exercise-induced bronchoconstriction or EIB. And it's a very common type in which, as a person starts to exert force or start to do any sort of exercise, they start to have difficulty with breathing and the airways basically immediately start to close up. And this is typically what affects about 90% of people with asthma. Next in this list is occupational asthma. And this type is triggered by irritants that are found in the workplace, things like chemicals and fumes, dust, gases, etc. Next is allergic asthma. This is a very common type as well, in which the asthmatic reaction can be triggered by allergens. That's going to be anything from pets to pollen, food, mold, dust. And it can also, this is the type that can actually be seasonal due to pollen. Next in this list is non-allergic asthma or intrinsic asthma. This is the type that is also caused by irritants, however, not the types that are typically associated with allergies. That's going to be things like smoke, air pollution, cleaning products, perfumes, cold air, and even viral infections. Next is a very uncommon type that is aspirin-induced asthma. Yes, the medication can actually induce it. Basically, by taking aspirin or other anti-inflammatories, uh, one can uh, one can develop an asthmatic bout, and this can actually be quite severe. It's a really severe type, but it's very uncommon. Next is nocturnal asthma. This is basically asthma that worsens at night, and excuse me, it can be triggered by things like heartburn or dust mites or even pets. Last but not least is cough variant asthma. This is a type that doesn't present with the typical symptoms. However, there may be a persistent dry cough. And if this isn't treated, then it can actually develop into true asthma and asthmatic flares. It can have many of the regular symptoms. These are the types of asthma. There are many other types that are still being studied and further classifications, but these are the major types. Now, a few tips that I like to give you because I don't like to give people a whole bunch of bad information with no solutions. My videos are always about solutions and what can actually be done. So the first solution that you can use that is natural, safe, and clinically tested is what is known as lycopene. Now, this is typically sold as as a supplement. It comes from, it's a pigment, it's an antioxidant pigment that is found in certain red colored um, fruits, such as watermelons or grapefruit, the pink type, or even tomatoes. Most people think that tomatoes are vegetables, they're actually fruits. And it's not, if you look up lycopene, you're going to find a whole lot of information on prostate problems. That's because it is used for treating a condition known as BPH, benign prostate hyperplasia. And it also can reduce the risk of prostate cancer. However, um, lycopene has also been studied for protecting against exercise-induced asthma. So this is something that you can consider using. Make sure you speak to a professional about it. Next is pycnogenol. Pycnogenol is getting really popular these days. It's also a natural compound that is extracted from pine bark. Very well studied. Tons of research on it. Many benefits. It's not just an anti-inflammatory and antioxidant, but it also has the ability to boost circulation. It can improve your cardiac function as well as your respiratory function, and even treat certain conditions of the circulatory system, like chronic venous insufficiency that can cause varicose veins. It can also treat pain. It's great for your blood pressure. Uh, and it was also studied for menopause, but last but not least, asthma. Supplementation with pycnogenol has shown that it can actually improve and control the signs and symptoms of allergic asthma, as well as reduce the need for medication. So, pycnogenol is, like I said, well studied, has a lot of benefits, and can be useful for improving the lung function in patients with this condition. And vitamin D is a really important one. In fact, this should have been the first thing I put on this list. Now, vitamin D supplementation can reduce asthma related emergencies as well as asthma attacks. And the deficiencies of vitamin D are seen and very commonly associated with decreased lung function as well as a reduced response to medication. Vitamin D is something that is crucial for our survival and for our immune system function. Now, when it comes to allergies and things like that, those are immune reactions. To regulate that, to regulate inflammation in the body, to improve the way our immune systems react, vitamin D is really important. There's so much to vitamin D that I could do. I mean, I could talk for days about vitamin D and the importance of it for health. But just in a nutshell, apart from what I mentioned here in the slide, it's also important to note that in another study, it was found that children who develop asthma, most of these children were actually deficient in vitamin D. So this is really important. I would strongly suggest getting on top of this and making sure that your vitamin D levels are up. And if they're not, you might want to supplement with them. Last but not least is an age-old remedy that has actually been studied in a clinical trial. This is ajwain or celery seed tea. And this has potent bronchodilator effects, can actually open up the airways. It was used in a really interesting clinical trial, which I'll post in the description, and it was actually able to improve the symptoms of asthma. So this is another remedy that I would strongly recommend. And of course, you need to speak to a professional. Make sure you have a proper diagnosis. This video is just for information purposes. If you'd like to get in touch with me, you can do so through my website, drnishal.com. I do online video call consultations. So no matter where you are in the world, you can get in touch with me and I can help you. And I'll see you in the next video.